Before we dive into today's topic, a quick note. If you're looking for personalized medical consultations, you can message me directly on Telegram at My Private Doctor. You'll find the link in the description below. Now, let's get started. Reactive poststreptococcal arthritis is an inflammatory joint condition that occurs after an episode of Group A Streptococcus GAS pharyngitis. It may represent a mild form of rheumatic fever or could be an entirely separate entity. Compared to rheumatic fever, it is a milder illness and, importantly, it is not associated with other major Jones criteria. This form of arthritis typically develops about 10 days after the initial strep throat infection, noticeably earlier than rheumatic fever, which usually appears around 21 days post-infection. Clinical features: arthritis non-migratory. Unlike some other post-infectious arthritides, the joint involvement doesn't move from one joint to another. Presents as monoarthritis or oligoarthritis, meaning one or just a few joints are affected. It's generally more severe than the arthritis seen in rheumatic fever, and notably it is resistant to aspirin, ASA treatment. Skin findings: you may also observe Erythema nodosum, which presents as tender, red nodules, usually on the shins. Another possible finding is Erythema multiforme, characterized by target-shaped lesions on the skin. Differential diagnosis: when a patient presents with monoarticular arthritis, consider acute osteoarthritis, vascular necrosis, gout or pseudo-gout, septic arthritis, both gonococcal and non-gonococcal. Lyme disease, malignancy, trauma seronegative spondyloarthropathies, rheumatoid arthritis, RA, systemic lupus erythematosus, SLE, sarcoidosis, cellulitis, bursitis, and others. For polyarticular arthritis, multiple joints, your list expands to include fibromyalgia, juvenile idiopathic arthritis, Lyme disease, osteoarthritis, psoriatic arthritis, reactive arthritis from other triggers, rheumatoid arthritis, rheumatic fever, serum sickness, viral arthritis, and more. Evaluation: the key diagnostic step is obtaining a throat culture for Group A Streptococcus to confirm that the preceding infection was indeed JAS pharyngitis. Management: if the culture returns positive for Group A Streptococcus, Penicillin should be initiated to eradicate any remaining bacteria. For symptom relief, NSAIDs are the mainstay. Aspirin is typically ineffective in this condition. Disposition: once the acute symptoms are under control and the patient is stable, they are usually discharged with outpatient follow-up arranged to monitor their recovery and ensure resolution of the arthritis. And that wraps up our overview of reactive post-streptococcal arthritis, its timing, presentation, differential diagnoses, and management. Don't forget, if you would like a private consultation, just click the Telegram link for My Private Doctor in the description below. Thanks for watching, and I'll see you in the next video.